Hi, everyone. Welcome to the Soul Sense podcast from Samaritan's Well here in the greater Dallas area. And today we have another special guest, one of our old friends of the ministry. We've done so much work together in conferences and seminars, and we've worked together in intensives and in the hospital. Carolyn Dunegan. She's an expert in addiction. She's an LCDC, a licensed chemical dependency counselor. And we're just so excited to have you here today, Carolyn.
Hi, thank you for having me back.
Yeah, we're so glad to have you back. We've talked about different things like codependency and all kinds of different really important issues. But today we're kind of starting a series. We're going to do a handful on addiction. And that touches so many of us in so many different ways. Whether it's directly or indirectly. And so just so glad to have you here with your experience of working with addiction. And of course, we work together so much. Let's just start with the most foundational question. What is an addiction?
Oh, thank you. It's funny. Most people start with how many drinks mean you're an addict? How much? What quantity?
Yes.
So, and none of that defines addiction.
Right.
So I will say this, I'll give you 2 or 3 ideas.
Okay.
Number one, what I tell a new client when they say, I don't think I'm an addict, I don't think I'm an alcoholic, I still have my job, I've never had a DWI. They'll always tell you, here's the things that mean you're an alcoholic or a drug addict. But I'll say this, have you had consequences? Just because someone hasn't had a drug arrest or a DWI doesn't mean they're not an addict or an alcoholic. So number one, have you had consequences? And we tend to trivialize the relational consequences. So someone's husband isn't speaking to them, their adult children won't let them keep their grandchildren, but because they've never had that DWI, see, I'm not an alcoholic.
Yes.
So number one, are there consequences? Also, and I want to give credit, there's an author who is just fantastic named Pia Melody. Her definition, and I don't know if she's ever written this, I heard her say it at a speaking engagement. She said, number one, addictions are about immaturity. So you look for immaturity in someone to say, do they have an addictive process or compulsivity they're expressing? The third one that I also really like is when you have substances like prescriptions, alcohol, illegal drugs, food, whatever, in the place where you should have a person. Because people that have substance abuse or substance dependence, and I can define that for you too, they usually have a thing where a person should be. So someone can't wait to get home to be alone with their wine. They can't wait to go on vacation and, smoke pot every day. They can't wait to be alone with their process, their behavior, their thing, their substance. So it's like someone who's looking at pornography and they mean to look at their phone for 10 or 15 minutes and they look up, it's been 3 hours. Okay, addictive process. But they're spending their alone time with substances or behaviors. So when you have drugs or alcohol, and the drugs can be legal or illegal, that's usually a spot where you don't have a person. And so don't think this is about people that are alone. Someone can be married, they can have children in the house, but their time really is built around when can I get alone and do my thing? When can I be alone with my behavior or my substance? Or someone will legitimize, like, well, I only drink wine and it's only with dinner. Really? When was the last time you had 3 consecutive days without any wine? What? That doesn't mean anything. I didn't drink for a month, this year. Really? How come? So you investigate a little. Well, I was going to have surgery. Well, I had surgery.
Mm.
So number one, Are there consequences? Number
Hmm.
two, immaturity. And number three, having substances interfere with or actually completely take the place of where you should have a person. So
Wow.
someone, needs to be talking about issues. They need to be expressing something that's going on. They need to explore a loss they've had or job problems. And what they do is they get alone with their substance, and so instead of spending time with people, they spend time with their addiction. And you can have a house full of people. You can have children, spouse, employees.
You know, there's so much clarity in just those three that you talked about, Carolyn. Um, and I'm reminded even of number one. I used to work with Joe Dallas for several years at Every Man's Battle. I consider
Mm-hmm.
him a mentor. And one of the things that he would repeat to us over and over is never confuse the absence of consequences for permission to continue. And that's what a
Amen,
lot of
Joe.
people do, right? It's like, well, I haven't
Yeah.
had the DUI yet. I haven't
Mm-hmm.
been fired yet.
Mm-hmm.
That may be just simply a grace period, but don't confuse just because there hasn't been those serious consequences yet that there won't be, right?
Mm-hmm.
And so
That's so
that
good.
kind of that kind of goes into that thing of, we talk so much in the big picture about hitting bottom, which I'm sure we'll, be talking about some today, but it really comes down to, okay, what degree of consequences are enough for something to change? Because we
Right.
know if you want something you've never had before, you're going to have to do something you've never done. So back to our
Mm-hmm.
three, have you had consequences? Addictions are about immaturity, which is painful, but it's true. And then substances in place of people or a person. And that goes with our relationship with God too, right?
Mm-hmm.
You have someone going deeper
100%.
in their relationship with God, and they have some free time and they take a walk, or they pray, or they meditate, or they worship. But with the substance, it's going to be stealing your time, isn't it?
That's right. And also, people become a little more isolated because they have this soothing behavior. I want like eating or drinking or smoking pot or taking pills or using coke, or so they have this thing they want to be alone with, and so they become isolated. And because you can't say, well, I can't go this weekend, my wife's out of town and I want to drink all weekend, so you have to start lying to people. I've got a lot going on. Yeah, I might come by, I don't know. Or, well, the kids, this, that. So you become a liar so you can be alone with your addiction, or you become a liar in terms of what's really going on, and you become isolated. So this is the subtle, how someone devolves and they start to lose their identity and they start to lose their character. Because once you start miss, miss, missing things, you become absent. You maybe go, but you go for a short time. You say you're here, but you're there. You say you're tired, but you really have been drinking. You say you've had one drink and you've had three. You smoke pot, so you can't go to lunch with everybody because that's where you do your little one hitter. You tell this doctor you're still in pain and you're not. You get a refill. It's all little lies, but you become a liar and you start to fracture and you become secretive. People can't really juggle doctors like they used to for prescription drug addiction, because now there's, digital information. DEA is a lot, more involved in prescriptions than they used to be. But it's subtle, but you think, I haven't changed. I'm taking care of my kids. I don't miss work. But the little cracks become, 5, 6 years down the road, they're massive. So the other things you start to see secrecy, isolation, and there's always progression. So if we had one word that was all caps, the way I find out if someone is abusing substances or dependent, I look for progression. So if you're interviewing someone or you just want to have a litmus test for yourself right now, what did your substance use look like 15 years ago? What did it look like 10 years ago? What did it look like 2 years ago? Progression is the biggest indicator that someone's gone from recreational use, abuse, dependence.
Um, that is really helpful, Carolyn. And let me ask you, I mean, in my experience, and I have such a small amount of addiction experience compared to you because it really is a field. If you know the mental health field, it's important to specialize in that area because it's
Yeah.
so nuanced, right? But in
Mm-hmm.
my experience, there you just don't have an addiction without the lying. And I suppose
Mm-hmm.
it's first you lie to yourself and then you lie to
Uh-huh.
others. I don't know. I
Uh-huh.
think that's the way it works, right? Is
Uh-huh.
that a fair truism with addiction?
That probably could be our biggest indicator, actually. I was
Okay.
in a clinical group years ago, and one of the therapists said, how do you treat addicted people? How do you stand it? Because no one in the group would see substance abuse people. They referred them all to me. And I said, well, why? I said, I enjoy the work. She said, well, you never know when they're lying. They're such liars. And I said, well, you just assume they're lying. You don't
Yes.
assume trust. You don't extend trust. They have to prove they're not lying to you. You don't extend trust and see if they blow it. You always assume they're lying. So on an assessment, whatever someone says they're using, you times it instantly by 3
Mm-hmm.
because every addicted person will tell you, yeah, I have 1 or 2 glasses of wine at night, or
Yeah.
I have to take the hydrocodone. I'm taking it because I had a back surgery that failed, and you don't know how much pain I'm living with. They
Right.
get really offended
Yeah.
when actually they're running errands, going out with friends, cleaning out closets. They don't need the hydrocodone a year after surgery. They want it. And
Yeah.
so you times what anyone tells you they're using by 3. And this
Mm-hmm.
is this is where psychiatry and mental health is a model that will fail the chemically dependent or the substance abusing person every time, because these models are built on confidentiality and privacy. And you can't understand what's really going on with someone that has an addiction, whether it's porn, food, gambling, working, drugs, alcohol, unless you interview their family members, because they will always minimize and they won't tell you what's happening. They'll say, I've got a great job. I'm happy. I'm paying my bills. But what you don't know is they have the 4th job in 4 years, or they used to have a career and now they have a little hourly job,
Mm-hmm.
or they don't have to work,
Mm-hmm.
or their family has complained for years about how they behave. And they have, gone to their doctor and said, don't give her any more of these pills. Please
Right.
stop, you know. And so the privacy allows the person to create a narrative where it will take you a year or 2 to unravel who they are. Right. So someone will say, I have to have these pills. It's, I'm still suffering, I'm still hurting. But then you see them running errands, going out with friends, cleaning out their car. So they really don't need it. And you always have to imagine that substance abusing person has given you a story you have to assume they're minimizing when they come in and give you their narrative. And it's several reasons. One, they want to protect the substances or the drinking just in
Mm-hmm.
case they go back to it.
Mm-hmm.
And the
Mm-hmm.
second thing is they frequently don't see reality. So what they're telling you, they believe. And so even if you're really discerning and you know when someone's lying to you, if someone believes what they're saying, you're not going to know they're lying. And so even a therapist that's extremely intuitive will not understand what's going on with someone who has a substance issue. So you have to tell them up front, I at some point will need to interview your spouse, your partner, your one of your adult children. I will have to get a bigger family history here. So you have to treat a substance using person or an addicted person. Again, pornography, food, gambling, whatever.
Mm-hmm.
You have to corroborate. You have to have the support of people around them to get a real picture of what they're doing.
Carolyn, this is such a good overview. So we're talking about big picture. We've talked about kind of what is an addiction. So we've got like an overview of that. Now, just let's talk about what's the process for someone getting sober or getting free of an addiction. Big question.
Mhm. So I tell families, so typically the way I get inherit an addicted person, regardless of what they're addicted to, I almost always will get a family member first who'll come say, will you talk to me and help me with my son? Can you help us with my mother? Can you help me with my wife? So when someone needs to get sober, that doesn't mean it's time. There's ought to get sober and there's want to get sober.
Oh,
And yeah, and the ought to is what you usually have first. So you have to understand an addiction ends regardless of whatever it is, chemicals or behaviors. It ends over a 2 to 5 year period, which is heartbreaking for a lot of people because they'll come in and they'll want, it's early intervention, they're doing great. And sometimes that can happen. But first, the person has to get caught multiple times before family members or loved ones take it seriously. And they'll say, well, if you just drink a little, or just drink less, or just don't smoke pot. Well, the street drugs, it's cocaine, it's meth, it's these people you're hanging out with. So the first intervention is almost always the person saying, I can fix this. I've got this. I'll dial it back and I'll go back to the way I used to just use pot on weekends. I used to just use Coke on vacation. It's just the people I was around. They had meth. I shouldn't have gone over there. I will drink less. I will only drink wine. I won't drink liquor. I'll only take the prescriptions the way they're prescribed. So, first, you have to let that person try several times to fix it themselves, which is a 1 or 2 year process.
okay.
And most people have already tried. They get up in the morning, they're in the shower, washing their hair. Today's going to be different. I'm not going to blah, blah, blah. It's going to be different. So, first, they start making rules. I'll only use on weekends, I'll only drink one. I won't drink when I'm alone anymore. I'll only drink alone. I'll only drink at meals. I'll take it as prescribed. I won't take hydrocodone. I'll switch over here and I'll take tramadol. I won't take tramadol. I'll switch over here and I'll just take small amounts of So a
Mm-hmm.
drug addict will try and change drug families or how much.
Sure.
The addict who's using street drugs will say, it's these people. I'll cut these people off. Or I won't use any drugs. I'll just drink. And so, first, they start developing a series of rules for themselves. I'll just use 1 or 2 nights a week. I'll only do this, I'll only do that. And that can be a 1 or 2 year process of that person saying, I've got this.
And it seems like our first problem here is that it starts with I.
I.
I, wait a minute. I has not been too powerful at doing this in the past, so I
Uh-huh.
may not succeed in the future either.
Yeah. Well, you have to short circuit that when someone comes in because their spouse will agree, yeah, if you could do it that way, I'd be
Sure.
okay with it. If you just drank and no drugs,
Mm-hmm.
if it just wasn't street drugs, if you
Mm-hmm.
just, and so the spouse will agree and come against the therapist. The problem
Yes.
with that is they have typically already hundreds of times. I'll just have one. I'll just have two, just on the weekend. No more of this. I had a client tell me once, I've had a breakthrough. And I asked him, oh, good. What was it? He goes, no more, no more Jack, no more Coke. From now on, just pot. And he said, I'm a new man. Because here's the thing, they will make rules for themselves about how they're going to control or change the way they're using. And the thought of using nothing is never an option. So addicts all believe alcohol's not a drug, and alcoholics all believe they can return to drinking in moderation. I will somehow dial it back and do this in moderation because they've done it, because
Yes.
they've drank less hundreds of times. They've gone on family trips and not drank at all. They've gone for months without drinking and lost weight, started working out. They feel wonderful. I'm ready now. So when someone says, I'm going to do it this way and not that way, you want to say, well, how many times have you tried it? The drug addict thinks pot's not a drug,
Right.
and the drug addict thinks alcohol's not a drug, and the alcoholic thinks if I just do this in moderation.
Mm-hmm. Mm-hmm.
And
Well, and
so
yeah, I was just going to say, very appropriate time for what I've been taught is the 11th commandment. Thou shalt not kid thyself. But we all
Uh-huh.
have to be aware of that, don't we? Because when it comes to addiction, there's so much self deception. If I could do this or I do that, and it's bargaining, they bargain with
Uh-huh.
others, they bargain with
Mhm.
themselves, and probably bargain with God too.
Mhm.
But that's that first stage. You cannot get to the second stage until we've exhausted the first stage. And like you said, sometimes that takes a while.
It can be years because deep inside of every addicted person is the thought, if I ever really, really wanted to stop, I could stop. If I ever
Yes.
really, I mean, really wanted to, I could stop. And so they have to go through that sometimes, like I said, for years. And the times they have stopped gives them a false sense of power. And this is why people come into 12-step programs like NA or AA. And the first step is you're powerless. They're like, no, I'm not. I quit. But what I'll tell them is, yeah, you quit all the time, but you can never stay there. You never stay quit. So the thought that they can do it themselves, the thought that they're an addict or an alcoholic is like, no way. I'm still working. I haven't been arrested. And then the last thing is the thought of no substances of any kind for any reason ever again is so big and so painful because they don't want to think there's nothing they can safely use. And so an addict will start drinking, but what that looks like 3 years down the road is they look just like that drug addict again. It's just a new substance.
Yeah.
And so the pride, people don't think they're addicted, they think they're weak, they hate themselves. And so they will try for years to change how they use, and then they will try and do it themselves. Even having the epiphany, there's nothing I can safely use. I abuse whatever I put my hands on if it's mood altering. even then they'll say, but I don't need those 12-step programs. I don't need a therapist. I don't need to, I need to start working out. I'll go to church more. There's all these great, like, here's what I'll do. Everything except ask for help.
Well, and Carolyn, you and I both worked with Leonard Cassee back at Green
Uh-huh.
Oaks back in the
Uh-huh.
90s. And you were probably at this CEU lunch one day that he did, but I'll
Uh-huh.
never forget. He started with a question. He said, "Do you want to know why addicts are addicts?" And everybody, looks around and said, "Yeah, we want to know. We want to know." And he said, "They don't like themselves." And I have never found an exception to that. They may appear to like themselves on the surface, but it seems like to a person, they're carrying so much shame and degrading and honestly self-contempt. And it seems like one of the things that keeps them in the addiction is to just numb out that shame and self-hatred they have for themselves. Now we're going in a little different direction, but
Yeah. Yeah. Now people can have shame and self-hatred and not like themselves and not have addictions, but it's rare that they don't have something, some device, or some way to derail that awareness. Because I have people that do too much. They have 10 projects in their yard. They have 15 errands they're running. They're in constant
mhm, mhm.
motion, and they don't want to be alone with how they feel about themselves.
Yeah.
And so then a wife, a girlfriend, a friend, a child will come and try and share feelings with them or confront issues, and they'll panic. They get combative. They come out swinging. They don't want to know how you feel because it will trigger how they feel. And they have a life carefully crafted around not feeling their feelings
Okay.
because it's typically shame, inadequacy, failure, self hatred. And those things feel so true that they do whatever it takes to not have to sit in that reality of, I'm not good, I'm bad, I'm weak, I'm gross. And they've endorsed that, they've agreed with it. And so they build a defense system, which, if you have an addiction, instant defense system from knowing how you feel, but they could also just be too busy. They
Mhm,
could be compulsive in other ways. They could
mhm,
be controlling. They could be addicted. They could work 60 hours a week. There's
mhm.
a long list of ways you cannot be aware of how you feel. They can have outbursts. They can control conversation. They can use anger. Someone may be volunteering or living for their children. And on the outside, that looks amazing, but it could be a profound need to just not be alone with themselves.
That's so good. That is so good. So we were talking the process for someone getting sober, getting free, and we
Oh,
know the
yeah.
first stage we have to get through is I can fix it. So what's the second stage?
Okay. The I can fix it means I am not going to consider having no substances. The
Okay, got it.
next stage is, I can't safely use anything. I can't drink. I can't use drugs. There's nothing I can safely use. I'm going to have to get rid of. I've got to be totally free of mood altering substances.
Okay.
But in that second stage, the epiphany that you have to be completely abstinent, completely clean, the person will, I'll do it, comes up again. So first is I'll do it differently. The second is, okay, I can't do anything, but I'll fix it myself. And that second stage, someone will start working out. They'll go back to church. They'll, start running, cooking, or they'll start overeating. So one addiction comes off the table. Typically, someone will quit all the substances, but then you see overeating, overworking,
Mhm,
sexual compulsion.
mhm,
They'll replace it with something,
mhm.
and they'll have, it's called I think, flight into health, where it's like a pink cloud. It's a miracle. I feel amazing.
Yeah.
They'll even start helping other people, like, oh,
Hmm.
I
Hmm.
quit smoking, I quit drinking, I got free of drugs. But it's a short burst of health because it's all under their control. And when the triggers, shame, self hatred, feelings of inadequacy, feelings of loneliness, despair, because addicted people, before they ever express addiction, if you go back to childhood or teen years, they already felt lonely
Yeah.
or alone. They already had a feeling they were failing. They already had embraced the idea, I'm different, I'm bad, I'm weak, I'm gross. No one wants to take care of me, no one loves me, or I'm not safe. I shouldn't be here, you know. So they already have a core of self loathing or self rejection, a fear they're inadequate, terror when they feel guilty. They overreact in a profound way to guilt, so they can't navigate issues. So
Yes.
their girlfriend rightly comes to them, a boyfriend, a husband, an adult child, and says, hey, that bothered me. And they overreact and they can't process it. And so then the desire to not be in their skin, not feel how they feel about themselves, comes back with 10 times the force. And they either go into a new addiction or they just retreat back into the old one. So those um, episodes of controlling their addiction can be months. Sometimes it can be a year or two, but it always ends because if
Wow.
they don't go back to the core issues, the process of not wanting to be alone with how they feel will always come back up.
So the next stage must at least include actually facing and going back to the core issues. So tell us about that next stage, Carolyn.
The third stage is ask for help,
Okay.
which you would think that's the first stage. It is
Yes.
not. So again, someone will 3, 5, 7 years try and do all these other things. So they finally ask for help. And this was the hard thing working in the treatment centers, because I've worked in multiple treatment centers.
Hmm.
You would see someone who had terrible things happen, car accidents, loss of job, separated from children, um, intense depression. They'd finally get to treatment and then they would not do what you told them to do. So they finally get the help, but they still want to control how they see themselves. So
Yeah.
you would say, hey, you need inpatient. I don't need inpatient. I'm not like those people. I can just do outpatient.
Yeah.
Or they would go through inpatient. We'd say you really need to go to AA or NA when you leave. You need
Hmm.
to get bigger help. You need to actually step down and go into a halfway house, or you need, a year of therapy with a chemical dependency specialist, you and your,
Hmm.
and they say, I'm not doing that. I've missed enough work.
Hmm.
Or, so they would start telling you what they will and won't do. So they can't share control. And because
Wow.
they won't share control with people who know how to get sober, they go through all this pain, sorrow, finally ask for help, but they still want to control what that looks like. So the therapist says, hey, you need to take a break from all these other things you're doing. You need to spend more time, on your recovery. You need to put your healing first. You need to do some trauma work. And they're like, nah, I'm not doing that. My mom and dad were saints. I don't need to talk about any of that. so, so the asking for help is only the beginning of the end.
Okay.
Okay. And so when someone accepts the help and they surrender and they let someone else tell them how to do it or tell them what to do, when they let a therapist, a counselor, a 12-step program, when they let someone else say, here's the real roadmap, Here's what you actually have to do. And they do it. And so it's a level of surrender, it's a level of humility. And remember, the juxtaposition here is someone who has tremendous shame will always have an unusual amount of ego. It's almost the counterbalance. So here's the lethal combo: they have an unusual amount of ego, but very little self esteem. And that is the hardest person to treat in any therapy setting, is the low self-esteem and the big fat ego.
Give us an example of that because I know that's profound, but I need to hear that from you.
Mark's like, isn't that all your clients? So, okay. Okay, so you need some ego strength. You have to compete in the world. You need to sell yourself. You need to be able to do things you've never done, take risks, step out, do something scary. We have to have ego strength. Okay. And you have to have a little like, hey, I've got this. I can do
Sure.
this. I'm going to try this. That's ego strength. But when the person that has a lot of ego fails, if they don't have self esteem, it's like, okay, I'm going to dust off. It didn't work. It's kind of embarrassing, but what was my part in it? What should I learn from that? So if I have self esteem, I can go back and go, you know what? Here's what I did wrong.
Mhm.
If I have self esteem and someone confronts me, I can say, you know what? Tell me more about that. Oh, I am so sorry. You know what? You're right. I really was selfish here. I'm sorry. So people that don't have self esteem don't apologize. They don't examine their part in things. They don't learn from their mistakes.
Mhm.
And so they don't mature. And so that person with a lot of ego and no self-esteem, if you try and say, hey, I want to talk about something you said a few weeks ago, or I want to talk about an experience I had with you that doesn't feel good, they'll overreact, because the minute they feel guilty, they come out swinging and they'll attack you. They'll flip the subject onto, but you, they'll start accusing you, they'll lie, they'll panic because they again believe they're bad and that you're pointing it out. They don't hear, hey, something you did didn't feel good. They hear you're bad. So they attack, swing, criticize, change the subject. And so the person with ego doesn't age emotionally.
Okay.
When there's conflict, they still act like adolescents. They don't learn from their mistakes. They can't examine themselves. They don't apologize, because all those things evidence self esteem.
That's
There's even
so
a,
good, Carolyn. Yeah. But you're saying they're so stuck in that shame and condemnation, which means I'm bad,
uh-huh,
that they use this ego to defend it in a sense or counterbalance it, right?
accuse you and
And
make sure
so
they don't feel it. Right.
yes. And so that fits with all our stages that we've talked about. The first stage is, oh, I can fix it. I'll dial back my substance. I'll go
I've
from,
got this.
yeah, I've got this. I can fix it. And their spouse might even agree, yeah, that'd be fine if you
Yeah.
only drank on weekends or whatever. The
Perfect.
second
Right.
stage is, wow, I can't safely use anything, but I'll make that happen. I don't need AA or a counselor. I certainly
I've
don't
got
need to
this.
talk about my alcoholic mom or my abusive dad or
Right.
anything painful like that.
Right. I'm
So
not
I've
like
got it. Yeah.
those people that have to get help. Right.
The third stage, we're getting closer. You're asking for help, but this 3A is when I ask for help, but I still want to control it.
Yeah.
And I'm guessing here, it seems like the obvious next step is I finally get to a place where I ask for help and I give up control. Tell us about that.
Yes. Okay, so there then the person would be at what in NA and AA is the first step, where we admitted we were powerless over our addiction and our lives had become unmanageable. And the unmanageability is the expression of the consequences.
Okay.
Because it would be heartbreaking. We would have someone finally land an inpatient, but they were controlling. They wouldn't do what they were suggested. They wouldn't do follow up, or they'd say, I'll do this and not that. And then it never failed. 6 to 18 months later, they'd be in the facility again.
Yes.
And they would concede maybe one thing. I really should have not seen my friends I use with. I probably really shouldn't have, missed those meetings. I probably should have done aftercare. So they would give you one concession, but they wouldn't really just wide open humility. I have failed at this. I need to take direction. I need to partner with someone and let them tell me how this works. And so pride is the number one reason most people don't get better, whatever they're getting help for, whatever their issue is, because the capacity to say, I am broken. I need help. I'm not special and unique. You know, I am just like other people and I have to have help. But also, I think the humility. So, what happens with the isolation and the secrecy is the addicted person, no one really knows them. They want
Okay.
to control how you see them. So, they control what you know. And so, they're really extremely isolated because they have to manage their image, they have to manage how you see them. But then,
Hmm.
when you start to connect to the lies and the false narrative and you endorse it, they're mad at you because they're lonely. They
Oh,
want
wow.
closeness. So, accountability, number one thing in all treatment programs, all 12-step programs, and all therapist programs, all therapy and counseling settings is accountability. And when someone allows accountability, they let you talk to their husband, they let you talk to their adult children, they let you talk to their wife, or they let you talk to them without coming out swinging. They'll take suggestions. They do what you ask. They say, I did. Okay, I got a mentor. Okay, I told the guys at church what was happening. I told my adult children I actually had relapsed. Hey, I told them at work I had to go to this aftercare program and I couldn't work weekends anymore. When you give someone something to do and they go do it, the humility, they let you tell them what to do, and they don't see themselves as unique. They will allow the idea, I am broken, because someone wants to say, oh, I had a phase in my life where I was broken, but it's gone now.
Right.
So the pride has to be put to rest, the control, the secrecy.
Um, there's a great verse that fits with this, and there's verses that fit with, I think, everything Carolyn said today. But in James 5:16, it says, confess your faults one to another and pray one for another so that you may be healed. That's that walking in the light, isn't it? That's that accountability that
Right.
is that we can't avoid. There's no way around it. We don't see freedom without coming into the light.
Hmm. I will tell people the first thing you can do to get better is start telling your real story to people. Pick one
Okay.
person, pick two people. If you start saying who you are and telling the truth about who your parents were, who your family was, who you are as a parent, who you are as a person, if you start becoming real, it's an act of humility. As long as you need to idealize yourself, your family, your children, your history, as long as you can only present the idealized version of who you
Hmm.
are, you're very isolated. You're
Yes.
alone and you can't heal in a vacuum. You can't heal and control information at the same time. And you can't bond with anyone if you control information. So if you're trying to bond with someone and control what they know and how they see you, it makes everything in your life temporary.
Wow, that is so good, Carolyn. I will tell people in a nutshell that I've had this classic kind of thing show up so many times, but I'll tell it like this. First session, tell me a little about your family you grew up in.
Uh,
Well, my mom was an alcoholic and my dad beat me, but they did the best they could.
they were great
And I
people.
always, yeah, they were really great people. Now, we're not saying that they're all bad or anything like
Uh-huh.
that, but we know when they say they did the best they could, there's a denial. And
Mhm.
so as we unpack things, we're really trying to say, how could you forgive anyone in your life that's hurt you until you're honest about it to yourself and to others and to God? How can you grieve something until you're honest about it? Even scripturally, it says cast your cares on Jesus because he cares for you. But I tell people, you can't cast something until you pick it up and hold
You
it
did
close,
it.
right?
Mhm.
You got to own it first. And that's what you're saying. So as we go through these, how you get free from addiction, ultimately, the I, in a sense, has to be set aside. I have to ask for help from God and others. And, oh, this is hard. I have to surrender control. Lord, I'm willing to be made willing to surrender control. But it's scary for these people, isn't it? It's real scary.
Yeah, because at base, and this could be true for anyone coming into counseling for any issue, they don't believe that they're broken, they believe they're weak.
Yes,
And
that's
they
good.
don't believe they're broken. They don't believe they have something that they can't didn't cause, or they're not responsible for. They feel like if I was a better person, I wouldn't have this issue. And so the idea that something's bigger than you have issues you didn't cause, you don't want to be this way. Let's pull these thorns out. Let's pull out these causal kinds of things. So at base, people believe, I'm just weak. I'm just gross. I'm bad. I'm weak. I ruin things. And so they believe if you start digging around, you're going to see it and you're going to reject them.
Right.
If you get too close to me and you get over the wall, you'll see that it's me. I'm just bad.
Yeah.
And so I will tell you 80%, not 100%, but I'll let you over the wall this much, but not this much.
Yeah. That's so good, Carolyn. And, my last verse that I think is probably all of us, it's just right here, a very, very straightforward verse from John 15:5. Jesus says, I am the vine, you are the branches.
Mhm.
Whoever abides in me and I in him, he it is that bears much fruit. For apart from me, on your own, you can do nothing. So we
That's so
really
good.
just see this parallel, right? It's
Mhm.
like when you try to do it apart from God, apart from his direction, his leading, and honestly his people, right? Then you can't do it. But man, this has been so rich, Carolyn. Is there any uh big picture or overview or final words for as we talked about this great question of what's an addiction and what's the process for getting sober? It's been so rich, but any final words, Carolyn?
The takeaway, if you grab one thing, a capacity for honesty, telling people who you really are, letting people talk to you about how they experience you, and telling your stories, the sad ones, the embarrassing ones, telling your story. So, any focus on the truth, and really, it says in the word, the truth will set you free. I would say it's only the truth that creates freedom. And so that would be my soundbite.
That is so good. Well, Carolyn, this was our foundational podcast on addiction. We have three more coming. Very
Uh-huh.
excited. There's so much here for ourselves. Honestly, I you can hear that there's things for all of us in these lessons. whether we have the profound addiction or stronghold or someone we love, or it's just about, man, there can be those subtle ways that we kid ourselves, that we lie to ourselves, that we
Mhm.
need to be honest. So thank you so much. I'm really excited about our next podcast. We'll be doing those over these next few months. And we so appreciate you being on, Carolyn.
Okay, and then the next one, I already know people are going to say, but wait, I'll describe the difference between social and recreational substance use, substance abuse, and substance dependence.
Thank you so
All
much,
right, you
Carolyn.
guys. Bye bye.
Thanks for being with us on Soul Sense. If something today resonated with you, take a moment, write it down, and reflect on it. And help us reach other people by subscribing, liking, leaving a comment, and sharing. We'll see you next time.